Welcome to CompliancePro Solutions Cybersecurity Practices in 2023. I'm your host, Kelly McLendon, and I'm going to be joined by my partner, Chris Lyons. We're excited to bring this presentation to you today because cybersecurity, of course, is the ultimate hot topic and changes every single day. So we tried to stay paced with updates in the rules and the guidance and the practices. And for 2023, summertime 2023, we've done just that in this presentation. Today's presenters are myself, Kelly McLendon. I'm Senior Vice President of Compliance and Regulatory Affairs for CompliancePro Solutions. I've got 45 years practice. I'm mostly the privacy SME. I understand regulatory security, but nowhere near my partner, Chris Lyons, the Director of Cybersecurity for CompliancePro Solutions. He's got decades also of experience in the security industry. He's led security teams and developed strategic plans, conducted all kinds of security assessments, but he has specialized in the HIPAA and the healthcare security arena for all of his career. So certainly glad to be working with and presenting with Chris. He's really more the expert. I'm going to introduce you to the Cybersecurity Act and a little bit about the HICP practice updates, and then turn it over to Chris, who will dive a little deeper into the technical aspects. HICP cybersecurity practices, 405D and Public Law 116-321. The start was kind of an innocuous law, the Cybersecurity Act of 2015, also known as Public Law 116-321. Within that law, they are working to facilitate a voluntary private-public cybersecurity threat information sharing. They clarified the National Cybersecurity and Communications Information Center, or NCCIC, role in evaluating and responding to cybersecurity threats and risk. So those are on a national level. They share information about national cybersecurity threats and even focus down narrower than that, but it is a basic clearinghouse of all types of information related to cybersecurity threats, practices, how people are evaluating, detecting, responding to such risks. So this law pushed those information sharing activities and that role of that NCCIC. It also created voluntary cybersecurity standards, the 405D practices, as they're called. And these are for healthcare. They're not for general industry. They're for healthcare. They're consistent with HIPAA security requirements, but this is very important. They do not replace the HIPAA security requirements. What we have done at CompliancePro, when we assess for security, we're assessing typically in a HIPAA type environment, we're assessing for HIPAA security and the implementation of 405D practices for cybersecurity. We do both of them together because while they overlap, they do represent some differences between them, and 405D cybersecurity practices by themselves do not constitute full HIPAA compliance. So we do have to add in HIPAA security requirements into things like assessments. We would recommend that for anyone assessing your security operations. The nice thing about the HICP practices for cybersecurity is that they are more practical and relatively cost-effective and broken out for healthcare organizations of all sizes and resource levels, from small, medium to large. And that's very important because we've always had problems figuring out how does the HIPAA security rule apply to small environments as well as extremely large IT environments. HICP, this public-private partnership that put together these practices, thought about that and created their tools and guidance along the lines of small, moderate, and large size facilities. And so they have created numerous documentation managing threats and protecting patients. And we'll look at that in a couple of slides. But all of this is built upon the NIST, the National Institute of Standards and Technology, Cybersecurity Framework, the CSF, which is a very commonly accepted cybersecurity framework or sets of requirements and practices that should be implemented. And all of this from HICP and the 405D is built on top of that framework. So has legitimacy in the United States and really around the world because of that. And it's an important item to note. 405D and the public law. Again, HICP, the Health Industry Cybersecurity Practices, are flexible and built to fit small, medium, and large healthcare organizations. This is an example of what they call a recognized security practice. That's being requested by the regulators, for example, Office for Civil Rights, which enforces HIPAA. But we've seen investors, cyber liability insurance providers, and different organizations also looking for proof of recognized security practices. The 405D HICP practices are recognized security practices. So they're an example that can be used. And the reason why this is important is in 2021, there was an amendment to HITECH that allowed Health and Human Services, any of their agencies, such as OCR, to consider a mitigation and fines, early favorable termination of an audit, or mitigation remedies that normally result in a corrective action plan, that they would be flexible in application of such penalties and enforcement activities if they find deficiencies in your security program upon an investigation or an audit, as long as you had put the recognized security practices into place for 12 months prior to being investigated or looked at by the agency. And that's what basically it's telling you in the blue box, that under the law, when they're making determinations regarding fines for failure to comply with HIPAA requirements, this is especially on the security side, and standards for wrongful disclosure of individual identifiable health information, the secretary has the ability to consider whether the covered entity or the business associate has adequately demonstrated that for at least 12 months it engaged in recognized security practices. So what we recommend is that you do a security risk analysis and that you include these practices in that risk analysis, and that way are covered both on the HIPAA side and on the cybersecurity side, and possibly can reduce your exposure to enforcement after 12 months. So the HICP group, again, the Public-Private Industry Consortium, is federally mandated under these laws to create, but voluntary and participation. Not sure everybody thought that would really work out that well back when the law was passed, but it's actually created this terrific guidance in these cybersecurity practices with the enforcement perks. So again, take a look at tools, educational materials, policies, assessment materials. They have free versions, but vendors like ourselves obviously have more depth and also have those types of tools and assessments. There is a reason why folks use third parties for security and privacy assessment and risk evaluation. However, some sites may choose to do it themselves in certain years. That is allowable, but we think has a higher level of risk because as third parties, we see the market evolve and are assessing on the most current information possible. Anyway, there is an overview slide deck at this link that will tell you more about these programs. There's also a video from Office for Civil Rights that explains the recognized security practices, what they expect. You don't have to use the 405D HICP practices as your recognized security practices. There are other frameworks to use that you can, and this video explains that. But by far and away, the easiest way, the most organized way, the only ones that really account for small, medium, and large facilities is, in fact, the 405D cybersecurity rules. So this video is out there should you wish to view it. Again, point of clarification, 405D doesn't replace the HIPAA security rule requirements. It's rather that they complement with HIPAA. They overlap, and all that can be reconciled during the assessment and remediation phases of an implementation project. And you would just add your 405D practices into a security rule assessment. Chris and I have done that with ours, and it was not an easy exercise, but it was doable. So that's the practice side of what we chose to do so that we can evaluate both sides at the same time. And there are a few areas, if you're curious, that are in HIPAA that are not really in the cybersecurity practices. So breach determination and management, that's HIPAA. More detailed education and training discussion, that's HIPAA. Auditing and monitoring, vendor management, other controls under HIPAA specifically line up under there, and less so in the cybersecurity side. So again, there's room to push these two sets of guidelines and requirements together to create a bigger and better whole. HICP practice updates. So they did an update to their practices here in 2023. They refined and continued the evolution of the practices, which they had published again earlier. So for example, email phishing now is called social engineering. They've expanded the bucket that they had as far as a threat that was email phishing, because that is a very big threat, of course, maybe number one, but there's really many types of phishing and other activities that are labeled social engineering. So they made that change. They changed the threat. And, there's similar definitions, but social engineering is a wider scope. And they've added things like smishing, whaling, business email compromise. So there is that piece to the threats that's been added in this new update. They've also updated network connected medical devices. They had medical devices listed, but they have refined it a little bit to talk about network connected medical devices. And they have sub-practices they've added to ensure the protection of the growing use of such devices. And they updated the cybersecurity policies bucket or practice to be called cybersecurity oversight and governance. Policies is important, of course, It's key, and procedures goes along with that. But cybersecurity oversight and governance is a wider scope, and that is really better to describe all of the activities, including policies. So those are the actual updates that they did in 2023. And we've kind of listed them here. You can see on the slide. Oh, well, there's a couple of other sub practices that they added. Vulnerability management, attack simulations, provides entities a guide on the importance of performing attack simulations and outlines what to do in your own simulations. And then again, oversight and governance, a cybersecurity risk assessment and management. They tout the free federal tools, and those certainly can be used. But others, such as ourselves, would say that we probably have a more robust set of assessments. Cyber insurance. They talk about why cyber insurance is important and what policies should cover. That is invaluable information, we believe. The main document overviews 5 threats facing a healthcare sector and talks about how to use the publications. There's the link. And then there's a technical volume 1 and a technical volume 2. Technical volume 1 is for small entities, sort of like a single solo physician practice, small business associates. They can all get into the volume 1. Volume 2 are the medium and large entities. They're much thicker and longer. This is wonderful because you only have to deal with the guidance for your own facility. Now, they build on each other. What you do in the small practices will be augmented in the medium practices with some more. And then the larger organizations will have even further practices on top of that. But here are your technical volumes and links to them. And now that I've reached the top 5 cybersecurity threats, I'm going to turn over the floor to Chris Lyons, and again, our director of cybersecurity, who knows all of this inside and out. And then I'll go ahead and keep flipping the slides as he's ready. But Chris, you want to take it from here?
Thank you, Kelly, for that introduction and that intro into the 405D requirements. We're going to start next by talking about the top 5 cybersecurity threats. Most of these are not going to be new things. These have been around for a long time. They're just getting more focused now because they're becoming easier for the bad actors to use. So there's many different threat vectors. The enemies are fighting each other anymore because of the changes and the ease of doing this. They continue to evolve, they continue to get better, they continue to make options that they sell that someone without experience hacking could just buy a product, put a few keystrokes in, choose what they want to go after. It'll do the work for them. The threats, as always, social engineering, which of course the big portion of that is phishing. It's one of the biggest issues out there right now. That's why earlier when Kelly was talking, they moved it from phishing as being the threat to social engineering, because in there is also vishing and smishing and all these others. We're seeing a lot of different attacks in that field. A lot of those attacks lead to the next biggest issue, which is ransomware attacks. These continue to go on. They continue to be more prevalent and more damaging, unfortunately. Uh, the loss of theft or equipment, that's been around since day one. That used to be the #1 issue when you looked at the wall of shame and what was the issue. It was loss or theft of equipment was always one of the top 2. It's now further down the road, down that list, but it's still an issue. Insider attack, accidental or malicious loss. This is the people. Your employees always are one of the biggest issues, whether it's malicious or not. That's why we talk about training a lot. Training is so important. And the new one, attacks against network connected medical devices. This is something that has happened here or there, but it's becoming a focus. We have a lot of these legacy devices out there that have no security built around them. Social engineering, malware delivery, or credential attacks. What they're doing with social engineering typically is they're trying to elicit from that end employee information they should not have. They then will use that to attack your company further. It may be they want to get an email address that they don't have. They may want to get credentials. They act like they're your IT department. They need your credentials. Click this link and change your password. Another big one why it was moved to social engineering is one of the last things Kelly mentioned on the slide above is business email compromise. They're not just focusing on technical people or your general workforce that just may give you an in. A big one right now is they're focusing on your accounting departments. They're focusing on administrative assistants where they're trying to get people to wire money. They're trying to get you to think that it's the president asking the president of the company asking his administrative assistant to wire him money or to wire it to one of your business partners. It ends up going elsewhere. And they also use that social engineering to insert ransomware. It could be through a link in an email where you click, you go to a website, it downloads to your computer, and then ransomware, it crawls your network, looks for data, encrypts it. Big issue used to be with ransomware is you lost access. Lock your assets up. Hey, you pay me, I'll send you the code, you can unlock it. Of course, that disrupts your care. It prevents you from doing your business function. You can't bill if you don't have access to know what services you've provided. The big one on this now is that last bullet may result in a breach. I would change that to it is a breach. The OCR a couple of years ago gave guidance that stated it used to be if your information was encrypted, you didn't have to worry about it. Now, when they put that guidance out a few years ago, it was if you have a ransomware attack, you instantly are considered breached. Because now what they're doing is they used to just lock it. Now they're going in there and saying, you know what, just locking it's not good enough. They're exfiltrating that data now. Then they're locking it. So that now they're not just saying, I'll give you the key to unlock it or you lose it. I'll give you the key to unlock it. If you don't pay for that, I'm going to take this data that I have and I'm going to publish it on the dark web, and they're going to have all your patients' information. So that is where ransomware has gotten really scary. Loss or theft of equipment or data, pretty easy. People lose a laptop, a tablet. It could be somebody working in the company is exfiltrating data. It's any type of breach of that sensitive information can lead to patient identity theft. Healthcare records for a while have been the most valuable on the dark net. You can get pennies for a credit card number. I don't know what the newest data is, but you can get a lot more if I have that whole record. The reason is if I have your healthcare record, I can not only get healthcare, I can apply for credit cards, for cars, for houses, and it has happened. Insider accidental threat is number 4. This really, to me, is a bigger concern. It's rated by HICP as number 4, but insiders, your people that work for you are only as good as the training they receive. If they don't understand how to identify phishing emails or identify phone calls of someone asking for data, if they don't know how to identify that, they may unintentionally give out information. This one really more of the issues are unintentional, but there are some malicious. There's some stories that I've heard from clients that I've worked with before. For instance, one person was using their phone to take pictures of their EMR. That was intentional. Another one was somebody clicked a link, replied in an email to someone with information, that person wasn't who they said. It can lead to a breach of information, identity theft, a lot of issues for your patients, a lot of issues for your company, and attacks against network connected medical devices. We don't know a whole lot about these type of attacks yet. We know they're happening. We're starting to see them more. But imagine you have a patient on an infusion pump that is connected to your network. If it doesn't have proper security, if someone were to hack that device and up the meds or lower the meds, you can see how that can be a real big issue for well-being, but also disruption to treatment. So those are the top five that we need to worry about now. Are they everything? No, we're seeing new ones every day. So you need to be vigilant on any type of issue you're seeing. So next, let's talk about the updated top 10. Top 10 cybersecurity practices. They've had these out for a couple years now. They did a few tweaks back a couple months ago. And as you see the words at the bottom, they're strongly recommended. So these are not required by HIPAA currently. They are strongly recommended best practices. So you really need to think about putting these in. These are not the top of the line requirements. These are, hey, you put all of these in, that's everything you can do. They are really setting a baseline of this is the minimum you should do. So while they're strongly recommended, my suggestion is these are required if you want to make sure your company is at least at a minimum secured. Number one is around email protection systems. And you'll see a consistency here as I go through these 10. Most of these 10 all have current rules within HIPAA, but the way HIPAA was written was to be very vague. The same rule applies to someone with one doctor, for instance, at a practice, or a 10,000 employee hospital. So they're very vague for a reason. This is just going and digging a little deeper so that it fits within the small, medium, or large. So email protection, email system configuration. So it wants you to have basic email configuration tools, making sure you have an encryption method, make sure you have spam filters, make sure you have some type of phishing detection, something to detect these threats, specifically the social engineering ones, or the loss of data through unencrypted email. It puts in some requirements on training. So you now have to make sure part of your training is training workforce on how to spot phishing emails, how to spot phishing attacks, and then phishing simulations. Requirement now is you need to do these phishing simulations. You need to test your employees regularly. Quarterly is the current best practice, at least quarterly. And that's sending them a test phishing email. If they click on it, it sends them to a remediation page, lets them know, hey, you've clicked on this. Here are the indicators. And it gives them a little education to help them understand a little better. Why was that a bad one? What could I have done differently? Number two, HIPAA talks about protecting workstations. It doesn't really go into depth on how to do that. With the HICP 405D, they now are dictating basic endpoint protection, an EDR solution. So the nice thing is a lot of your antivirus products, anti-malware products have included in them EDR controls where they're not only looking for viruses as before, they're looking for any type of patterns or things that don't seem right. And they can identify those, report those back to a console. It allows companies to be able to see what's happening, try to catch things before they become an issue. So a lot of companies have those in place. They may not even know it, but check your endpoint controls. Access management. We know HIPAA requirements. They have a lot of access management in it. This is nothing new. What this does is it goes just a little deeper. It talks a little more around how you set up your basic user configurations. You need to have config baselines. You need to have so one thing that I know for as long as I've been doing the HIPAA assessments has always been you have a job description that ties to the rights. That's not stated in HIPAA. It was always kind of a known. This is going further into that. The next one, data loss prevention. Number 4, data and loss prevention, excuse me. DLP. This is an area where HIPAA always says you need to know where your data is, know where your PHI is stored. What they are now saying for under the baseline is establish your classification. It's something you should have been doing all along. I'll tell you from experience in doing a lot of assessments, it's not done nearly as often or as well as it should be. This is giving more information on, hey, you need to do your classification, classify your data by sensitivity. You need to then subnet your data based on job function or sensitivity, ways to be able to further lock that data down. Procedures for handling. You have to let you have to have procedures for how do we ensure our requirements are followed, how your workforce handles that data, and when possible, putting in DLP solutions on things such as email. Office 365, it's the biggest email use out there right now. They have DLP functionality within that product. So investigating that, implementing that where appropriate. It doesn't have baselines right now that says you must do it, but it very strongly recommends. Number 5, asset management, another area that HIPAA covered in multiple requirements, but was never real particular on it. So this is saying you need to conduct an inventory. You need to know everything that could be connected to your network. You need to update that regularly and manage those assets. If you pull it off your network, remove it from there. If you update the firmware, it has a new firmware version, update your inventory. If you dispose of an asset, if one is lost or stolen, update it to be lost or stolen. You got to keep it up to date. And removal. You need to make sure when you're removing these, they're giving you more guidelines of tracking that. Things like making sure you track serial numbers, where it was pulled from, when it was destroyed, having certificates of destruction, etc. Number 6 is network management. So HIPAA has a lot of information on network management. What we're doing with the 405D, they've said, basic network management, having firewalls, having access control lists, that's pretty general. Most people have that. May not be as good as it should be, but they have those. So we're focusing here with 405D segmentation. There are a lot of healthcare entities, not just healthcare. I've worked in other industries where flat networks, you really have no segmentation. If I get on the network anywhere in your network, I can traverse the environment. I may not be able to access everything, but I can get to every area of the business. What they're saying now is that's not acceptable anymore. I mentioned it in a previous one where when you're doing your data classification, you then need to think about how you're storing it. That's where this comes in. So now they're coming into maybe it's different types of appliances, your network attached devices, medical devices. Let's say you have both plug-in and wireless. You should have a network dedicated to just those plug-in devices. Nothing else should access it. You should have a wireless that just those wireless medical devices connect to. Maybe you have, so in a hospital setting, you have your emergency department, you have your critical care unit, you have your pediatric, you have your maternity. So they're saying now those areas should be segmented in your network. If someone works in the emergency department, they more than likely don't need to access the network for the maternity ward. So there should be tools in place, segmentation to keep that from happening. They give a little more guidance on securing. So if you have network closets, you have data centers, they should be locked. They should be uh, only accessible by people that have a job function in there. Segment your guest access from regular network. This is one that I see done pretty well currently. So if you have a guest wireless at your facility, it should be totally firewalled off from your regular environment. There should be no way someone could hack through that firewall and find a way into your environment. Because they do have people that do that. They'll drive through parking lots with access point detectors. When they find one, if it's unsecured, they'll get on it and they'll try to hack it. They'll see if they could get through that to get to your network. And while it was really a strong suggestion, it wasn't specifically mentioned in HIPAA, but intrusion prevention systems. At a very minimum now, they're saying you need to implement and operate an IPS. You need to be reviewing those IPS logs. You need to understand what type of data is hitting your network so you can know when someone is trying to send something nefarious or attack or compromise your network. Intrusion prevention systems are part of that effort. There's multiple ways to do it. They could be on endpoints. At a very minimum, you want them on your egress points where your data is coming into your network or your traffic is coming in. Number 7, this is one HIPAA had nothing about. They are now requiring vulnerability management. So now they are saying you need to conduct your regular vulnerability scans. This would be internal and external. What are these for? Detecting things like missing patches, ports that are open that shouldn't be. Um, Anything that has been identified as a security risk. If you have it turned on, you need to know it so you can turn it off. I would put under this also, they don't specifically go into it within the 405D for the small, but you see it under the medium and the large environments, pen testing. So really with this vulnerability management, you're not going to meet that without doing your pen testing. Again, it was never mentioned in HIPAA. It was always something that I suggested when I did an assessment, but some of those some companies say if it's not HIPAA in HIPAA, I'm not going to do it. So 405D is saying, well, we're going to say now that this is a best practice. Typically, pen tests you do annually, or if you have a major change in your environment. Right now, with these, external pen tests are the biggest concern. Some companies will decide to do their internal, depends on how segmented you are. Number 8, incident response. The HIPAA requirements always talked about having an incident response. What the 405D does is it says you need to now make sure you specifically establish procedures and guidelines for how you handle these cyber type of attacks. And you see there, especially malware and phishing. So what I would say there is big ones right now would be ransomware is huge, phishing is huge. So at a very minimum, you need to have in there these attacks. How do you handle them? What would your next uh, steps be once you identify one or think you know of one happening? So this just gives more information on building that incident response around specific cyber attacks. Also, they have in here joining information sharing organizations. There are a ton of them out there. SANS, you can go to CISA. I know a lot of the equipment manufacturers like Fortinet has that. Cisco has it. Palo Alto. They all have these information sharing organizations where you can see what are the trends, what's happening. There are also a lot of them that aren't tied to specific groups, but joining one of those, staying active in them, doesn't mean you have to do a lot of posting, but knowing what other people are posting about, what they're seeing, specifically around healthcare. One thing I haven't mentioned yet, but these phishing attacks, I was reading an article not long ago and over 50%. I don't remember the exact number, but it was north of 50% of all phishing attacks have been targeted to healthcare entities. Healthcare entities are well less than 50% of all organizations. That just comes to show how hard they are going after healthcare. Why? Number one, their information is valuable. Number two, a healthcare organization can't be without access to their data. So they figure if I go after that healthcare organization, they're more likely to pay than a company. They're also more likely, unfortunately, they don't have adequate backups. They don't have an adequate system in place to identify, to remediate, to mitigate how bad this is going to hit them. So number 9, network connected medical devices. This is a new area. This has never been in HIPAA, and I have been doing HIPAA assessments for approximately 12 years now. I have not yet come across one organization that does this well. Uh, Inventorying them, making sure they're secure, making sure they're updated. Number one here is they're going to say, hey, if you have these devices, you need to know where they're at. You need to know how they're connected. You need to know that they're being updated. Ownership of these devices has always been a hard one to identify. IT says, no, they're not ours. You know, another organization said that needs to be worked out. It needs to be better identified because it's already a hard enough issue to keep these updated and secured working with the vendors for these. They haven't been real good on publishing security updates. FDA has some work going on with that. That will help in the future. It's not going to help any currently approved devices. So this is the area they expect to start really exponentially being exploited. So it's important to get ahead of it. And number 10, Kelly mentioned above on a previous slide that this used to be called security policies, cybersecurity policies, excuse me. They changed that because policies are just a small part of your security. They've changed it to oversight and governance. So they've changed it to where, you know, you don't just need policies, you need a whole governance process, including buy-in from the top down. You have to establish that oversight, that governance program. Policies are just a portion of that. You build your policies based on your governance. Okay, next slide. So let's talk about the best practice areas. Email protection, we talked about all of these already. I'll go through these next few slides relatively quickly. Email system, education, internal phishing. This is around social engineering, ransomware, insider, malicious data. Endpoint protection, you have to manage that endpoint. That endpoint can no longer be sitting out there and it has antivirus on it, but I really don't have a way to actively manage it. That's a requirement now. Making sure your firewalls are set up on those endpoints. This C right here is the big one. Use MFA wherever possible. This is one that I have started advising all of our clients that MFA, if you do not have it in place for any remote connections, you are not meeting this requirement. If you do not have it in place for things like a SaaS-based EMR, you are not meeting this requirement. Those are areas that have been available for a long time. Any administrative access should require MFA. Part D there, this is something HIPAA never really talked about. Patching your systems. There's a whole lot more information on you have to patch these systems, how you remove them. Enabling encryption. HIPAA was always kind of squishy. They did finally put out guidance that said if you're not encrypting your systems, you're not compliant. This is more saying, hey, you have to enable that endpoint encryptions. We're now saying endpoint encryption should be on those desktops too, not just on portable devices. Access management, limiting users to what they need only, role-based access. If you see B here, this is one that HIPAA never really discussed. It was always if you have some generic accounts for some reason, you need a document, identify what they're for, management reasoning and approval. Now with the best practices, and it should have always been part of HIPAA. Do not use generic or shared accounts to access any data or manage any system. What is this for? Accountability. A lot of MSPs like to use uh, one login account at the client location, which can be you can do if you have a way to track who's using that account at your location. But if you have someone performing management roles or, for instance, accessing an EMR, never should those be shared because you cannot have individual accountability. Random audits, this is in HIPAA. Random audits of access to sensitive data. This really specifically, not totally, but specifically is around doing those random audits in your EMR. Auditing your end users to ensure they're only accessing what they should. They're not accessing their neighbor. They're not accessing the football player that came in and got care. Immediate deprovisioning upon termination. HIPAA always had the requirements of termination. They're now saying you must terminate immediately. You can't wait a week. You can't wait 2 days if you know they're leaving. Single sign-on, restrict privileged accounts, disable remote desktop protocol. That should have been in place for at least the last 10 years. RDP protocols are inherently insecure and have been for a long time. The data protection, again, policy prohibiting use of unencrypted storage media and devices. This to me is a specific call out to things like USB flash drives. If you're using them in your environment, they should be controlled, they should be documented, they must be encrypted. Have your procedures in place. How do you do this? How do you remove these devices? How do you know if someone is using one of these devices that's unencrypted? Education, education, education. We can't say that enough. The more your employees know about security, the more secure your company will be. And stating data classification structure, highly sensitive, internal, public. All companies don't use that same classification, but that's the basic type of structure. You have data that only a few people should get. You have data that's a little less secure that maybe a few more people can get. Internal, typically anyone. Public means your public website, typically things that I could go out and find without having special rights. Asset management, this just lists at a minimum inventory and ID, host name, the OS it's running, the MAC address, the location, how it was procured. Decommissioning for that is if it's been decommissioned, or life cycle. If you know how, if you have a specific, we keep them 5 years, they're gone no matter what, you could put that date in there. One other thing that I would suggest that's not on here, who is it assigned to? Or if you have a laptop, you know who has it specifically. The location is probably going to be a department. You need to know who it is within the department. Network management, this is talking more about segmentation. We talked about that. Restricting access from computers outside of your network, restricting guest access, putting in those IDS, IPS solutions, very important. 7, vulnerability management. We talked about this. The one thing we didn't talk about is attack simulations. That to me can be multiple things, but your pen testing, that's an attack simulation. Doing that on the external at a minimum. There's some other things there. I won't go through all of those. Incident response. Again, this has been in HIPAA for a while. This is talking about you need to focus that now, not just on your regular security incidents, but your cyber incidents, and joining an information sharing organization. Next slide. Medical device security. We talked about that one. Update to the latest version. That's a big challenge. Any of these, I did an assessment at a client. The last time was about 3 years ago now. They still had systems that required Windows 98 to run. That was a big challenge for them. And we talked about cyber security oversight in governments, documenting your policies, your procedures, your have an education in place. Cybersecurity training should be part of your regular training. Security training anymore, just things like best password practices or don't share your passwords, not enough. Now you need to be training on phishing and ransomware and things like that. Conducting your risk analysis. HIPAA never stated, they said regular or as needed or whatever the exact wording was. The intent was always annual. That's the first thing they'll ask for if you're going to be audited. Give me your assessment within the last 12 months. Now they're telling you within this one, you got to do these annually. And cyber insurance is really the new big one. When HIPAA came out, there was no such thing as cyber insurance. Now they're saying you really should have it and make sure you have an adequate amount. And our last section here, key elements of a security plan. So this really is kind of everything we just talked about, but focusing on the governance and oversight. You need an effective leadership. For you to have an effective cybersecurity program, it has to have buy-in from the top down. It has to have everyone along the chain understanding why you're doing it. What is the purpose? Yes, it's important. You then need to have it well thought out, which includes all your policies. You have to have a risk-based plan. You can never get rid of all risk. You can never be totally immune to a cyber attack. So you have to set this risk base. You have to look cost versus benefit. Remember, for HIPAA, cost can never be a sole identifier of whether you implement a control or not. You have to analyze. It's going to cost us this. If we didn't have it, it's going to cost us this. What is that benefit there? You have to have adequate funding. Again, this is why it has to be a top-down buy-in. If you're not funded, you can't do it. It's not a inexpensive process, unfortunately. Then you have to have a knowledgeable leader. You have to have someone that is overarching review of this program, that can manage the program, can delegate, can have the right staff, capable staff that can monitor and identify and remediate these risks as they're identified. Assessment of risk, you utilize internal assessment and monitoring, combine it with a third party. Kelly talked multiple times. Our suggestion is third-party risk assessment is a very important portion of your cybersecurity program. Whether you have a third party every year do it, which I've had many clients that way. Some every other year, they'll have a third party, then they'll do an internal, or every third year. The really more than every 3 years, you're getting out there. And the reasoning for this is we have the expertise, we have the background. This is what we do all day, every day. Number two, I worked for many years on the other side. I was in there, I was implementing these things. I was the one on the other side of the assessment. As IT providers, we tend to, as we do things and work consistently in the same environment, we tend to get, and it's like that with any business, you tend to see what you've implemented and not see what you've missed. So when a third party comes in, they're independent, they don't have any skin in the game. All they're trying to do is, what are you doing? Does that fit within what are best practices or your requirements? And they're never looking to point fingers. Remember, this exercise required by law is, if you do it right, you're doing it internal. You have a partner that comes in and helps you identify issues, which is better than you have a breach and the OCR comes in and identifies them. Then based off of that assessment, you create risk-based list of items. And then you need to have that ongoing. You continue to do those assessments. You follow your due dates of remediation. You remediate the items. Remember, HIPAA is not hey, I'm a compliant or I'm not. There's really not a measure for saying a company, hey, I can give you this attestation, you're compliant. Because there's the bar for HIPAA is you have to do your annual risk assessment. You have to identify what are my risks. Then you have to have a remediation section, which you rank them based off risk. And the last thing is you have to show that you have an ongoing remediation effort and that you're making strides in completing those remediation items. Cybersecurity practices, 405D. Again, I know Kelly mentioned 405D, HICP best practices are not the only one. They are based off of the NIST CSF. You can use the NIST CSF directly. You can use SANS. You can use other risk-based cybersecurity frameworks as long as they are a recognized practice. You know, you wouldn't want to go to joessecurity.com and he says, here's what you should do. That wouldn't be a recognized practice. So if you have these, you can show a year of these in place. It can help discretion on fines. So when you're looking at this overall, the conclusion is these are cybersecurity defensive and offensive threat reduction programs. So if we're always in a defensive posture of let's wait until it happens, then we'll remediate it, that's an issue. You also need to be offensive. You need to have some of these put into play to stop some of these before they happen. And then you can work from there. Make sure you're following regulatory requirements, cybersecurity practices, remediation plans. Biggest thing in HIPAA is that you have those identified and you're working on them. Prioritized by level of risk or criticality. Sometimes we say you can work lower risk and high risk at the same time. That low risk may be a 15-minute exercise. You don't want to ignore it just because it's a low risk. If you can knock it out quickly, it's worth doing. And I'll tell you from experience, a majority of the issues that I have found over my over 400 HIPAA assessments, a majority, probably 50% or more, are policy and procedure based. So keep your policies, procedures activated and updated. And have the oversight structure, buy-in from the top down. If you have third parties that are providing you security services, they need to be part of your cybersecurity plan. And I'll hand it back to you, Kelly.
Well, Chris, thank you so much. That just was very informative, and I'm sure everyone appreciates it. If you have questions from our presentation, please reach out to us. We love to hear from folks that have viewed our materials, and here are our website, our email information, and a phone number. But give us a email and we will respond to your questions, and certainly looking for any kind of feedback.
All right. Well, thank you, Kelly. Thank you to Chris. We are now going to open this up for some questions. So, Chris, Kelly, are you ready for our first question?
Yeah.
I'm ready.
All right. So I will, let me see if I can actually put this on screen. It's a little bit of a longer one. Maybe I can't, but this is from Victor. Is there an estimation on the annual monthly investment cost per endpoint or user a small healthcare practice, such as a dentist or chiropractor, would have to pay budget to implement all the recommended controls? Major challenge for us MSPs is to go against very small budgets or a healthcare provider that does not want to invest in cyber compliance.
I'll go ahead and take that one. That's an extremely tough question to answer. Typically in these smaller environments, it's going to be very dependent on how reliant they are on the technology and how much they built it out. If you look at a company that has undergone some basic security all along, you're going to have a lower number. But I don't know if I threw a number out there for a, hey, per endpoint it's going to be X, it would just be a wild guess on my part. We like to start always when we're looking at those, especially the small healthcare ones, as there are some main areas. Here's where I always start. Do they have a set of policy and procedure in place for security? If they don't have that, more than likely the rest of their environment is going to need a lot of work also. So, I mean, unless Kelly, you have some idea from the privacy side of cost for that, I know for the security side of it, it is very tough to put in a ballpark.
No, I don't. I'm sorry.
Okay.
Well,
So,
Chris, can you just kind of go over a little bit then? How do you approach it for the smaller sites? How do you prioritize things like that?
yeah, and that's exactly
Because
what I
it is
just,
confusing, and we know that it is.
yeah, like I just said, the policy and procedure is always the first step that I start at. And especially if it's a small, 2 to 20, 30 employees, if they have a good set of policies, they probably have a relatively decent environment to start with. But what I find, especially with smaller, and I think a couple that were mentioned were like dentists and I don't remember a couple of the others, but especially dental facilities, small 1 or 2 doctor practices, they are usually running things on an as needed basis. So, hey, we needed a computer, we got one. It's probably got an individual login. So I start with policy and procedure. What do they have? If they don't have much, that's the starting point. You always have to say, okay, do we have these policies and we have to know what we have before we can protect it. So I do a look at what do they have in their environment? What types of systems? Okay, they have 10 desktops, they have a server, or they don't have a server. You've got to look and know what they have before you know how to protect it. Is their EMR solution SaaS based? Is it online? Is it hosted locally? You've got to take it in bites and understand the environment before you can really even start to understand what it may cost.
Good.
All right. Victor said thanks in the question area. That's all the questions that we have right now. For you, Chris and Kelly, obviously we had people sign up for this webinar. We don't have the questions here, but why do you think most people are interested in this topic today? Why do you think that people are coming here? Is it from confusion? Is it just to just get some more rounded knowledge? Why do you think people are attracted to this topic?
Well, the 405D rules are now, you can get enforcement mitigation or reduction on the HIPAA security rule if you put the 405D practices in place or any other recognized security practices. But since those haven't really been named other than the 405D practices, and the 405D practices are very well done, then it is now they're not required, but they are required if you want to get the enforcement reductions. So I think it's a topic of interest because of that. I think folks always are looking for cybersecurity tips and tricks, and what can we do? And the 405D is very, very clear, good with their prioritization, good with their materials, and I think it's driven people to seek out more information about it.
And I'll add on to that. I think if you polled the group, I think you'd find many different reasons. But I think also the key to it is cybersecurity right now. That's a hot topic. The healthcare industry continues to be by far the most attacked industry out there, even above industries such as finance. And also for the fact that the 405D rules themselves are pretty clear cut and they're based on company size. So instead of someone trying to look at a NIST CSF that is a broad framework and then they've got to pick their individual kind of topics they're going to implement, 405D is pretty straightforward. So I think that's a couple of the reasons I would say this type of information is very helpful.
Great. We had another question from the audience here from Beverly. Is there a good source for standard documentation that small companies can use as a starting point?
Is there security documentation? That was the question. Yes, we have sample template. We have policy templates, and we have assessments templates, and so we do have quite a bit of information here at CompliancePro that can be used as a basis to start with.
Yeah, and I think that, as Kelly said, we have those. A lot of other companies also have those. There are free, you can find some free templates online. Be very careful with purchasing templates from a company. They're usually, even our templates, they still have to be customized. And be careful of searching sites that you don't understand or you don't know that they are well known for it. I don't, some of the OCR, they have some of that they can provide through searching. I don't have exact directions to it. But with a security rule, sometimes it's tough to get a specific set of policies because every company's different. If a company isn't storing PHI on their machines or anything, they may not need an encryption policy. They're not going to have it. So there are some free areas you can find it. Be careful with those, but there are a lot of companies that offer templates, including us.
Yeah, and I will add in here, Beverly, that when we send out these slides, obviously that in the presentation just happened, there's lots of hyperlinks to documentation about the regulations, and some of those from the government also have links to some of this documentation. So that's probably gonna be one source that you can also go to. But as Kelly mentioned, the CompliancePro Solutions Library is an extensive resource of all these different types of documents. All right, I know it's now almost 2:15 here on the East Coast. Are there any other questions? If not, we can also just wrap up here. Kelly, Chris, any other last statements you have, or anything else that's come up in the last month or so that of note here?
I don't have any on the security side that have popped up. Anything, Chris, that popped up on the radar screen?
No, nothing new. As security is, everything's always evolving. We've got to take what we have here and what's published. Before they publish updates, there will be changes. There are things that happen. Nothing of note recently.
But it is of note. I will say that what Chris was talking about with phishing testing and things like that, that is relatively new and very important to understand. That threat is so high that they really have increased the practices surrounding testing for phishing and things like that. So that's a relatively recent change that, at least from what I know, and more depth. We've got to do more in that area. So it is.
Okay. Well, with that, I think we will wrap today's session. If anybody else had any other questions, the contact information is on the screen right now, but always going to our website at complianceprosolutions.com. You can find lots of different contact information there. If anybody on this call is going to be attending the HIMA conference in a week here where I am in Baltimore, we'd be glad to see you, and we will be on the show floor there and walking around. But thank you all for attending today, and look forward to speaking with you again soon.
Thank you.
Thank you, everyone.